Would you like to introduce yourselves?
Yeah, so my name is Remy Quiroga. My pronouns are they, them, and I am the Health Outreach Navigator with Peers Victoria.
My name is Shay Perkins. My pronouns are he or they. I work as the harm reduction educator for AVI, and I've been collaborating with Peers on a number of things for many years now.
We at Peers would like to start, before going any further, with an acknowledgement that we are on the ancestral and historical lands of the Songhees, Esquimalt, and Lekwungen, whose relational ties to this land have been for thousands of years. We understand at Peers, as we strive to be decolonial, that we work to try to address and respond to the impacts of colonialism on Indigenous peoples, which also carry through to the impacts of sex work and the overrepresentation of Indigenous people through sex work.
What is harm reduction?
So harm reduction is a framework of strategic practices and approaches designed to help minimize potential risk inherent to a number of activities. Typically, that term is used in association with substance use, but really it is any action that any of us can take in response to the harms that could be present within any action that we navigate in our lives. And really, we do it all the time, whether that's we wear seatbelts in a car, whether we use a taxi or a designated driver, if we might be drinking or consuming alcohol, whether that's checking with friends for something like sex work, or even through like connection with intimacy in community. Really, it's just like actions that we can take to find safety with each other.
Why harm reduction?
Harm reduction is an approach with its roots in HIV activism and taken up in response to the opioid crisis and the continued loss of life, as well as the impacts and harms created by criminalization and stigma. It is a trauma-informed, justice-based practice, as well as a philosophy rooted in community care, and essentially meets people where they're at without judgment or the need to stop using.
For Peers, harm reduction looks like providing sterile substance use supplies for safer substance use. It looks like providing safer sex supplies for reducing the impacts of things like sexually transmitted infections while engaging in things like sex work. It also means providing access to supports and programs, including STI testing and treatment, referral to community-based organizations and other health-based services, or other ways of getting connected to community and interventions that are meaningful and provide a sense of wellness.
What does harm reduction look like?
For Peers, harm reduction looks like providing sterile, clean supplies for substance use, whether that's injecting, inhalation, or other types of supplies. It means providing an avenue for safe disposal of substance use supplies, as well as access to things like safer sex supplies, including condoms and lube, to reduce the harms and risks associated with things like sex work or exposure to things like STIs. It also includes, for Peers, in the lens of sex work, could also mean access to things like STI testing and treatment, referral to other community-based organizations, including healthcare services, as well as bad date reporting. Overall, these strategies for harm reduction with Peers try to work with people in our community to reduce the harms inherent to life that we all navigate, including the lens of sex work. Really, at the end of the day, it looks like trying to be very body and sex positive, and also understanding that things like substance use aren't inherently things that are just negative, but can be, including with sex work, can derive pleasure and forms of connection.
At Peers, we have the tools for harm reduction, which include, but are not limited to, injection, inhalation, snorting and boofing supplies, as well as safer sex supplies including condoms and lube. Shay, what would be common substances injected?
There's many different drugs that you can inject, but for the big three that we'll focus on right now, you can remember by the names upside down. So up referring to crack cocaine, also known as soft for coke, or hard or rock for crack. Side referring to amphetamines, primarily crystal meth, also known as speed, gack, jib, crystal, or tina in the queer community. And then down referring to what used to be known as heroin, however heroin isn't very common anymore, and down is now an umbrella term that consists of primarily fentanyl mixed with various other opioid analogs, as well as often benzodiazepines. Other names you might encounter are pants, fent, or dragons when referring to smoking.
Syringes.
So our harm reduction supplies are largely provided for and covered through the BC Centre for Disease Control, or the BC CDC. And with that, they try to have a strategy to provide the most adequate coverage of supplies over the greatest breadth of people with the most desires covered as much as possible. And so for syringes, this looks like a 1 milliliter insulin syringe that is typically just over half an inch in length and about 27 gauge. This is really great use for any type of major veins, but smaller veins or vascular areas such as like hands or face that want to be used for injection supplies, you might want to look at a smaller syringe or a thinner syringe. With this, the main thing to consider is that once the orange cap is taken off, this syringe is not an auto withdrawal, so that needle will be always present, and to be quite aware of any types of pokes and avoiding any type of trying to put the orange cap back on. If you do find a syringe in public or through your work, the use of a sharps container to dispose of the syringe is the best strategy. If there is any type of needle poke, the most important thing to do is to clean the area and then immediately call 811 for advice.
Cookers.
So cookers are aluminum containers that you can mix and cook your drugs in that are easy to heat and easy to place down without spilling. They also come in different colors so you don't get yours mixed up with a friend. And they also come with a little filter for drawing your mix up through with a syringe, as well as a pad for placing over the injection site afterwards. Important things to know, it's easy for the filter to fall out of the package when you open it, and you want to place pressure on the injection site for at least 30 seconds afterwards.
Alcohol swabs.
So alcohol swabs are small wipes in easy transport containers that can be used to disinfect areas intended for injection use. So you can take them out of their package and then swipe once and away to help prevent things like MRSA, which are strains of bacteria that are really resistant to things like antibiotics. Important things to also keep in mind is to use them before injecting, not after, because the alcohol can actually prevent things like clotting and can cause increased bleeding, which can lead to higher risk of infection.
Vitamin C.
So vitamin C is used to break down substances that are not water soluble, primarily such as crack cocaine or some forms of down. It's also really good for helping break down pills or tablets. You only need to use a tiny little bit though. Using too much of it can cause it to burn when you inject. And a pro tip, it's also good for helping to take out the edge off of G if you're G-holing or close to.
Distilled water.
So distilled water come in these really handy small packets that are about 1 milliliter in size, and they're really easy to open just by twisting the top. Distilled water is used in injection substance use to help prevent anything like minerals that are dissolved in tap water or any other types of contaminants such as like bacteria or pathogens that could be present in other types of water. So usually 1 milliliter is perfect for any type of individual substance use, and please do not use any other type of water if you're going to engage in a substance.
Tourniquet.
So tourniquets are latex-free elastics used to tie off your circulation when finding a vein. It's important to note that you need to take the tie off before you shoot and not afterwards. Removing the tie after you shoot can cause more pressure and damage to the vein. It can increase the rush, which increases your risk of overdosing, as well as if you do not off with the tie still on, it can create more serious health complications with circulation. Do you know how to tie a tie one-handed so that you can take it off one-handed?
I do not.
Right. Like that. And then under there. And then when you do go to inject, after you flag, like that.
Yeah.
Inhalation supplies. Remy, are the same substances used in inhalation as they are in injection?
Yes, they are. Yeah.
Straight pipes.
So straight pipes come in 2 different sizes. They are primarily used for smoking crack cocaine. They are very fragile, so they're often given out in pairs, and it's important to check for cracks or broken ends when distributing.
Bubble pipes.
Bubble pipes are a pipe with a little bubble at the end of it, hence the name, and they are primarily used for smoking and inhalation for meth. Things to note is that the bubble area is quite fragile, and as well it's usually given out in multiples, at least 2 for a person, depending on their preference, just because with use, repeated use increases fragility and causes things like warping of the glass, as well as the glass itself can get quite dirty, like causing issues with like properly heating up product.
Hammer pipes.
Hammer pipes are used for smoking down. They help to avoid loss of product as compared to smoking on tinfoil, and are also used as an alternative to tinfoil, as there have been links to neurological health complications when using tinfoil to smoke long term. They are also very fragile, so it's important to handle with care. They tend to break where the bowl meets the stem.
Tubing.
So plastic flexible tubing comes in long coiled rolls, and it comes in different sizes to be able to accommodate and fit onto any pipe that is available or distributed. It is used for two main reasons. One is to create a short mouthpiece such as this. It can be attached to any pipe. So it does two things. It can prevent burning from hot product coming directly out of a glass pipe, as well as prevent cross-contamination by allowing each person to have their own individual mouthpiece while having like a limited number of like glass pipes while sharing the same amount of product. It can also be used to create a length of tube that can go down someone's sleeve or of the sweater or a long sleeve garment to allow discreet public smoking.
Screens and push sticks.
So screens are used primarily when smoking crack, but they can be used for any drug. They are placed inside the stem of the pipe to prevent the drug from moving down the stem. They also collect resin. There's a bit of a debate whether to use screens versus Brillo. Brillo is often preferred by folks because it collects resin a lot better than the screens do. But the Brillo breaks down very easily, and tiny bits of aluminum can break off and can damage the esophagus when inhaled. A possible solution to this is the Brillo sandwich, putting a few screens, a piece of Brillo, and then a few screens. And then the push sticks are used to place the screens inside the pipe.
Foil.
So foil is used to either store or smoke a number of products depending on the substance or product that you're using. Things to keep in mind are to not wrinkle or crease the foil, as a very smooth surface is really vital for easy use.
Remy, have you any other suggestions?
When it comes to harm reduction, in the confines of doing this video, we really tried to cover a broad range of what it could look like so you could have a good understanding of like entering the world of harm reduction. But there really is so much more to this world, and there's so much more of what it could look like and the techniques and strategies. So, a couple quick suggestions would be looking into this movement around safe supply instead of this idea of approaching it from crisis management of things like overdoses within the opioid crisis, providing safe, regulated supply of substances as a movement away from that. And then secondly would be having a spotter or someone with you if you're engaging in substances.
And Shay, any last words from you?
Yeah, I also really recommend getting your drugs tested if possible. Here on Lekwungen territory, we have Substance, the drug checking project, or elsewhere in BC, there's mail-in services like Get Your Drugs Checked in Vancouver, and also carry naloxone with you and getting trained in how to use it.